All right. Open up this meeting of the Yamhill County Board of Commissioners formal and informal session for August 27th of 2020. And Commissioner Stewart, would you like to lead us in the flag salute?
Thank you.
Okay, it's the only person I make eye contact with. So.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We'll move on to public comment now. And due to COVID-19 and physical distancing requirements, anyone wishing to submit general public comment or comments on agenda items may do so in written format by email at bocinfo@co.yamhill.or.us or by mail at 535 Northeast 5th Street, McMinnville, Oregon, 97128. Any comments received prior to the meeting will be shared with the Board of Commissioners and submitted to the record. And they need to make sure that my computer doesn't shut down. Bite defender, right?
Every time.
It's like, I need it open. And Carolina, was there any public comment? Okay, I didn't see any come through. Move on to item D, and we have a consent agenda today. And item D1 is our minutes. Commissioners, I saw that everybody had a chance to initial them.
Yes.
Mr. Chair, I make a motion that we approve the consent agenda in the minutes read from March, from March 3rd, 2020 to March 26th, 2020.
All right, thank you. And before we move on to vote, I just want to say thank you. They're great. I'm always amazed by how you capture things so clearly. Yes.
That's smart.
All right, all in favor signify by saying aye.
Aye.
Any opposed, same sign. The record show unanimous approval of item D1. Moving on to item E, which is old business, we have none. Move on to item F, which is other business. And item F1 is consideration of approval of amendment number 9 to agreement 159184 between Yamhill County Health and Human Services and the Oregon Health Authority, which is board order 19-228 for the additional funding in the amount of $4,220 for the financing of community health, addiction treatment, recovery and prevention, and problem gambling services, retroactive to July 1st of 2020 through December 31st of 2020. And Commissioners, do you have anything you want to add?
Just that it's as a result of increased utilization.
Yep, that's what I saw too. Okay, great.
So I would move approval.
Great. All in favor signify by saying aye.
Aye.
Aye. Any
Any opposed, same sign. The record show unanimous approval of item F1. Item F2 is consideration of approval to extend the current COVID-19 paid administrative leave policy, which is board order 20-91, to expire on November 3rd, 2020, or upon termination of the state of emergency declared by the Governor of Oregon, whichever comes first, unless extended by the Board of Commissioners. And Ken, do you have anything you'd like to add?
No, I'll just say that agenda items 2 and 3 is going to look familiar. We've done some previous extensions to these. And so this one, we're just asking for what equates to as a 60-day extension on both of these.
Mr. Chair, I'll make the recommendation that we approve the extending the current COVID-19 paid administrative leave, which is our board order 2019 to expire on November 3rd, 2020.
All right, all in favor signify by saying aye.
Aye.
Any opposed, same sign. Record show unanimous approval of item F2. And item F3 is consideration of approval to extend the current temporary COVID-19 telecommuting policy, which is board order 20-104, to expire on November 1st of 2020, or upon termination of the state of emergency declared by the Governor of Oregon, whichever occurs first. And this is an extension of a policy that we have in place.
Yes.
Well, I would, unless there's further questions, I would move approval. All in favor signify by saying aye.
Aye.
Any opposed, same sign. The record show unanimous approval of item F3. Thank you. Item F4 is discussion of childcare access and education support project. And I've got my name beside this one that you have in the,
Commissioner,
oh, yes.
I'm just wondering because items 4 and 5 are related. I'm wondering if we should maybe talk about 5 first and then go into the discussion about 4.
I think commissioners,
That sounds
does that sound
Sure.
okay to you? All right.
I'm sorry to interrupt.
Oh, no, it's okay. It's, I think this was the order in which I sent the emails. So I believe it was 2 weeks ago now, Ken and I think Carrie Martin together requested that we to move on to item 5, which is discussion of prioritizing the project list for Economic Development Administration grant funding. Okay, there we are. Just to get it on the record. Ken and Carrie asked us to prioritize the list that we had generated with their help in order to submit it to EDA through the Council of Governments. Have you all had a chance to prioritize that, or do you have it with you?
Actually, I have a handout.
Okay.
I won't start talking until I get back to the line.
That's right. Otherwise, we'll get texts saying we can't hear you.
So, thank you, commissioners. As we talked about, we had that list based on the ask from Regional Solutions to put together a list of projects, and then the secondary request was to come back and ask you as the board to prioritize the list that you had come up with. I received the rankings that each of you had done on the projects. And I just prepared this really quick spreadsheet to put together where each commissioner had things ranked. And I was trying to think of a way, well, how do we filter it? I just did a really simple and average. I didn't put any weighting to it. I didn't, any type of scoring or anything like that. So this is just a really simplified version that I thought would help you as you're wanting to have a discussion or review. And then based on that average that I put together, I put this in order of what the scoring looks like. So I just I thought this would help facilitate discussions. And if there's items that you want to see shifted, if you're okay with this ranking, or if you think there's further discussion that you'd like to see other projects that despite the scoring, you think this should be moved up or adjusted, I thought this may help you with discussions on ranking all these.
Yeah, and then once we're comfortable with it, we'll submit it to Council of Governments through Carrie, is what I'm assuming.
I believe Carrie Martin's, she's probably watching session, but if there's specific questions and if we want Carrie to join, we can have her join us via telephone if need be.
Commissioner Starrett, I'd like to note that we tied on the motel sheltering project. We both had a 2.
Yes, we did. And Commissioner Olson and I tied on the West Valley project.
Yeah, no, I'm really happy to see how this ranking turned out based upon all of our scores. So, sorry, Commissioner.
Yeah, well, I kind of, when I went through this just now, I kind of look at what the real outliers, what's really an outlier. And of course, the one for the West Valley, seems like, Casey, it seems like you were really, you're not 3, 4, 5, you're at 9, which really surprised me that it fell that far down the list, but that's how you rank them. So I look at the outliers and see what ones do we have where something is, and I have a couple outliers myself, that why the reason for that much of an outline. And those are the ones that are fairly within 3 points of each other, 4 points of each other.
Yeah.
I don't have any concern, but the real outliers are the one that is it that we don't understand something or we haven't discussed it enough. That's my comment.
Yeah. Well, I'd say that with the one with the Willamina Relief Nursery, I scored it lower because there's a lot of funding that's already gone towards it. But seeing your strong interest, I would say that I would enthusiastically support doing what we can to get them over the hurdle. And what I did note actually that is also the Newburgh offerings. It's good to see. But I would hope that if we can figure out a way to make sure that the Willamina one happens first and gets prioritized, if we can focus on that. Does that make sense? And I think that was your intention, right?
Exactly,
Yeah.
Mr. Chair. And the reason why this is so critical, and I tried to look at it with an eye toward what has more urgency.
Yeah.
And the reason why this one, and I ranked it number one, and I believe Commissioner Olson perhaps thought the same thing, is that we have gotten to the place where we have put so much time, money into this. We also know we have this discrepancy in population, but we also know that the vast majority of abuse and neglect cases are coming from the West Valley.
Mhm.
This, we know, based on what the Relief Nursery has done in the county, is really effective, especially with COVID and everything else. We've got a concern here. We were ready to open in September. And because of this little glitch and this little water issue, which could have a fix,
Mhm.
they just can't get over that hurdle. So it sits there,
Okay.
ready to open the doors. And that's why I think that's critical. To me, the Willamina project is the priority.
Sounds good.
So that's
That
why.
makes sense. Yeah. Yeah. And there's a lot of partners involved in it too. I mean, I think that's a compelling part of it too.
Right.
Right. And I think my understanding with the Economic Development Administration is that they want to see jurisdictions, nonprofits working together on a project.
Right.
I was just involved, as part of the child care access conversation. We were just talking about scrambling to find spaces in the city of Willamina and in Sheridan where licensed child care providers could set up. And so that came to mind, is that here's a site that's not ready but we have everything else ready for it.
Right. And there's a modular unit there, so
Right.
it's really turnkey ready.
Yeah.
And so, yeah.
Well, and that's kind of like the next one, the rural broadband project for specifically the Amity and Dayton areas.
Mhm.
That one I have no problem with the rating because we were all within like 3 points of each other. So we all realize that's important. But I think we also realize the challenges that will cause. So that one to me is not an outlier. Those are what I would expect.
Mhm. Is there anything else that strikes you as you'd really like it to move, shift, change based upon the scores that you see here?
Well, I can tell you as I look at these, like you said on the first one, Casey, I look at these and I have a outlier on the hotel sheltering program.
Mhm.
And I don't remember why I had an outlier, but I certainly support it. And seeing that you two rank it up like a number 2, I think it is an option for our homeless and the people that need housing, that can't get housing for any other reason. So I look at that as a high priority too, and I'm not even so sure why I gave it 12.
Well, and I appreciate that. I think maybe, not to speak for you, but I think maybe it was because we already had funding in place, and we have typically, this has been funded a number of different ways. So it's sort of like, okay, why are we putting this on this list when it seems to be taken care of and addressed other places? So,
But I do think it's very important that we continue that program, at least for the time being. So if I look at it that way, after I read it again, I'm not even so sure why I gave it 12. And that's one of the ones that I was the outlier on. So I have no problem that I think that should be a higher priority. I think than you and Casey,
Mhm.
because it does affect our citizens, and it does affect the homeless, and it affects anybody that can't get housing. I think it should be up around a number 2 or number 3. So I don't have any problem with change of upping that priority a little bit.
So maybe at this point, we could ask Ken, as far as the existing funding, the funding that we know is in place, the funding that we know is in the pipeline for that sheltering project, where are we with that? Because I know there was money from the CCO, and we had
And we did
CARES.
we did a contribution on the original request that came forward. There was an ask that the board approved, and that funding, YCAP received the funding that was approved, and since then, we've gotten reimbursement from CRF funds
Okay,
for that amount that we received. But that was for a specific window, but I know that from what I'm hearing, they didn't spend it all during that time frame, so some of that could be carrying over post-July, because originally, the funding request was only for, I believe it was April, May, and June. And so the one-time funding request that we received, we provided that.
Yep.
They have not come back with a secondary request or any ongoing funding request associated with that.
Yeah,
Because it expanded through August.
right.
I
That was
believe.
the last I remember.
Yeah, so it was expanded through August, and there were also other funds that were forthcoming. So I think that the immediacy as in terms of the need,
Because I believe the CCO made a contribution.
Yes.
We made a contribution. I believe the city of McMinnville made a contribution. Even the city of Newburgh may have made
yes,
a contribution. I don't know the status of all the other funding. I know there was a number of funding asks that went out to also some of the smaller communities. I don't know the status of all of those. I haven't heard an update from YCAP or anything.
Yeah.
So I guess as I looked at, being the outlier on that one, is even though we have got reimbursed for a lot of the funding, putting it at a higher priority, maybe we won't need to have any more funding, for a while. So I never looked at it that way. It's, well, we've already funded most of it. It's kind of there. And we may not have to fund anymore. We might be able to get more CARES money as the next time we do our report. But should that dictate what the priority is? And probably not. I think the priority, that could be moved up a little bit in the priority from my standpoint, but that doesn't necessarily mean we have to spend the money on it. It's important, but it shouldn't have anything to do with it. How we rank it shouldn't have anything to do with whether the funds are available. So.
And I know that Alexandra is working on finding a longer term source of funding. So I think that's probably the part of our prioritization is how can we elevate this so that funding sources recognize the value of it to our community.
yeah. And I think right now, the key is going to be to look at what is COVID related and what is going to just be medically fragile or chronically homeless and don't have that risk factor, or can you separate those distinctions? I don't
Right.
know.
Yeah, that's a good point, actually. Other things that you may either want to add, change?
Not necessarily. I'd like to drop back to the YT expansion
Oh, yeah.
project for demand response service. That one, to me, McMinnville does such a great job of on-demand service. You don't have a lot of on-demand service in Newburgh or other areas of the county, and I think that keeps some people from getting the doctors in McMinnville, doctors in Newburgh, and that's why I ranked that kind of high.
Yeah.
Not that you guys ranked it low, because you really did. Mary was a little bit lower, but I think that's just part of all the service we provide to our seniors and those that can't drive.
Yeah.
Homeless to have that kind of on-demand service. So that's my own comment.
And I agree with that. And I kind of ran out of ranking, so somebody had
That's
to,
the problem.
somebody
Me too.
had to fall. But I think that one of the reasons why I didn't make this super priority, although I think that the future of mass transit or public transit is going to be that we do more on demand. It's more cost effective and maybe fewer large buses. But one of the things I thought about was the other option of non-emergent medical transportation, which is available through the CCO. So I don't know if we're serving the same population or not, but typically it's going to be Medicaid patients, and that funding is available. So maybe that would be another option we could backfill until we do have more capacity.
True. Anyway, I just wanted to bring that up. So I could,
Yeah.
where it fell out as a 5, when you look at the average ranking without doing any weighting or anything, I think that's probably about what it should be. So.
And it looks like, so there are some that are, ties for ranking. I mean, I know that probably the EDA or at least Council of Governments wants us to have a sequential ranking, but I'm also fine with just 1, 1, 1, 2, 2, 2.
Yeah.
And terms of signaling to a funder that these are projects that we consider all to be an
Even though we
equivalent.
rank them 1 through 15.
Yeah. Yeah. So I don't know if that's, I mean, what do you think, Ken?
Well, again, I just put together, and that's why I put the caveat on the averages. It was just a way, because there's no weighting to it. And
Yeah.
I didn't, it was just to help facilitate discussion. So the other option would be, is you kind of see the guiding, and we could go through each project and we could say, does this need to be number one?
Mhm.
Should this be number two?
Right.
I'm trying to think of an efficient way
Yeah.
that we're not necessarily going through a complete repeat of the scoring exercise or
Yeah.
kind of going through the merits of each project. But if the board is okay with how these have kind of shaken out or fallen in order from top to bottom, unless there's something that's really standing out that, because like Commissioner Olson mentioned, the hotel sheltering project, that maybe that one should be moved up a little bit in the order, but maybe not. It might be as simple as switching the on-demand response with the sheltering project as far as priority rankings based on the discussion I was hearing. And just kind of throwing out ideas I know this is a difficult exercise in a formal session
Mhm.
we talked about this, we got the projects on there, we
Right.
score them, we bring them back. Now we have this in front of us. Now, how do we need to make final adjustments to the list?
I mean, oh, yeah, good.
No, I was just going to say, it's kind of like playing lifeboat.
That's what I was thinking too.
Yeah.
I was thinking the split the baby metaphor,
Solomon.
but yeah, that's more
Yeah.
I don't want
appropriate.
to split baby. But if you look at it that way, what Ken said, what you said, Casey, I believe that, if I looked at it that way, and, as he said, what's really a 1 and what's really a 2?
Yeah.
I would say if I looked at this list, anything that's a 4 or a 5
Mhm.
composite, those are really, if you look at all those are really ones that are critical. I mean,
Mhm.
so if we said like 1 through 4 or 4 and 5s or even 4s, but 4 and 5s are really the critical ones, or at least the 4s, the first 3 are the critical ones. Because I think they all make sense. I think the 5s, the expansion and the emergency motel placement, I think that's pretty critical. So I don't have any problem if we took just the 4s and 5s. We kind of made them a number 1, even though they have their own ranking. If we said, okay, what's really important?
That we're not willing to say this is our top. These are our priorities.
Yeah,
Yeah.
doing something like that.
I'm perfectly fine with that, and
So what if and only because these grants to our businesses is important, that brings us to 6 projects.
Because grants are important. The private industry and private business is one of the critical things. So if I look at that
Yeah.
6,
Yeah,
the
yeah.
strategic investment grant to respond to COVID-19, I wouldn't have any problem making the 4s, 5s, and the 1-6 as our number 1 priorities. I mean, that's one way we can bite it off, and Ken can just add another column and say, okay, here's our individual ranking, but here's what we really see overall after discussion. These are really not our top 5.
Yeah, the only thing, because if I remember correctly, when we've had a lot of things going on. And I don't believe they were looking for guidance for us to necessarily reduce the size of the list or eliminate it. I think it was really acknowledgement that the board came up with these 15 projects. And again, it's up to you if you want to narrow the list and to a smaller number, and then we would further prioritize that remaining list. We could do that. But I think they were really looking for us to prioritize the total list of projects and not necessarily identify the top 6 and then drop the others off. I think we could do that. I think that may help us in giving information to regional solutions on what the priorities to kind of
Sure.
narrow that a little bit, so
Yeah.
that option is available. I just wanted to,
Yeah,
if there's something down in those lower sections, I don't think we're necessarily have to go through the exercise of dropping it from the list unless the board wants to.
Right.
I think they're all important. I think, Ken, going back to what you said, if they want to just what we think is important, really, the 4s, 5s, and 6s are really important. So I'm not so sure we even have to, because they're the highest ranking. I'm not even so sure we have to go through another, say these 5 or these 6 are our number 1 priority, because I think the ranking already shows that those are our number 1 priority.
Yeah.
Even with the outliers on some of them.
Yeah. And then again, this list will also, not in addition to the EDA funding, will go to regional solutions as part of their regional business opportunities. So I'm thinking, some of them that if we keep the list as is, then some things like the Sportsman's Park enhancement, that's going to stay there, and it's going to be something that is that prompts them whenever there's a grant project or a grant funding cycle that is specific to safety and aviation.
And that will be a long wait because we've been trying for years on this project.
I know, but this shows that hope springs eternal.
And
We got it on the list.
it's on the radar.
Yeah.
Right.
And I
Yeah.
totally agree with Mary on the Sportsman's Park, but if you really look at it, it is long-term, because even though it's a private park, it still requires FFA approval. There's a lot of federal stuff that it's got to go through to make it, to actually, even though you're just overlaying it, maybe you're not expanding it, but there's a lot of federal stuff that has to go through too. So,
Right.
And so I don't think that takes away the importance of it. But if we look at it that way, I think it needs to be done. And it could also fall, if we really look at that and we look at how we graded things, that could actually fall underneath the one that talks about, the one that talks about the grants, that could actually fall underneath that too. So
And the things that are further down on the list are largely what I see as your traditional infrastructure projects. So I think it's important to have those present in the event that there is an infrastructure package at the federal level. So in summary, I'm happy. I would be fine. I think it would be a simple way to do it is to just say the way that they're on this list is the way that we prioritize them, acknowledging that if something is slightly under another, it's not that we don't still love it. Does that make sense?
Right.
Okay.
Gives them some good information to see the disparity as well.
Well, I
Yes.
know with like other counties, as we all know, that like the master plan for the fairgrounds, every county is going that they have, trying to get in the legislative fix that they will give more funding to fairgrounds and everything. So it's not that really isn't important. I said it was pretty darn important, but when we do that, realizing that it is important, but it may not really be, even though I ranked it a 5, it's really important, but that doesn't mean that we may have to spend more funds on it. There's grants available and everything, so.
Mhm.
So I don't have any problem with that one either.
And I'd just like to acknowledge that as the member of the commissioner liaison to Parkway, you did a really good job of representing Parkway. Commissioner.
Yeah.
I just saw that one.
Yeah, well,
Way to
it's
represent.
great, and that's why I really dropped the phase 3 for the Parkway.
Yeah, I saw that, yeah.
Because ODOT's already doing some preliminary surveying and everything. So it's like, but I kept phase 2 construction
Mhm.
high, because I think that's where the really bottleneck
Sure.
we need to clear that bottleneck.
Yeah.
And that'll clear it from Newburgh totally. So.
Yeah. Well, I think it'll be helpful to have it there. And I think that completing phase 1 of the relief nursery, having it as the very top should help, because I'm imagining that the city of Willamina probably submitted the same thing to the Council of Governments. I'm just guessing. I don't know. You mentioned that they were very much on top of it as well.
Well, they've been sort of trying to work with the fire department, and
Right.
yeah, they've been very active in this whole process,
Yeah.
especially the little bump in the road we've.
So Mary,
yeah.
being that you said that, the actual description was to construct a facility on the grounds of the school. Do I understand the facility is already there? They can't open it?
It's ready to go. There's a
Mhm.
modular unit and everything's ready to go. The only problem is they found there was a water flow issue and the fire department would not give them permission. So what they're hoping to do is at least get, have some funding for a temporary fix, which would get them over this hurdle as they work on the bigger infrastructure, because
Build
We're
a new
talking-
building or
yeah, I mean, we're talking about, as far as they knew, they were opening
Mhm.
next week.
Oh, okay.
And we're not there yet, and these kids have nowhere to go.
Mhm. Do you know what the cost of that is looking like for the temporary fix? Do they have a sense of that?
They do, and I don't have that figure in
Okay.
front of me. I can find that out. But they did have a dollar amount,
Mhm.
and that was apparently going to be acceptable.
I'm just wondering, would it be a reimbursable CRF?
I don't know.
I know, because it's
Yeah.
part of an existing project. Sorry.
What I would think with this is, as you know, because one of the other projects Carrie Martin's working on is we were talking about the community requests that we've typically done during the budget process. We're working on that. Maybe that's where this program would be more closely aligned, is coming forward with a request through that
Yeah.
program and from one of the other funds that we may have available for that type of project.
Yeah.
Unless there's a direct connection to COVID-19 response, recovery, or, unless there's a direct connection, it wouldn't
Okay,
fall under.
okay, good. That's
Yeah,
it's good to know.
Carrie's working on that additional project. I don't think it affects it being a top priority on our list, because since this way is being weighted with the region's list, I said there may be other funding available for it. And that the project Carrie's working on right now, they go hand in hand, but I don't think the project Carrie's working on right now should actually take the place of how we prioritize that.
Oh, yeah.
If Carrie turns great.
Right.
Yeah.
So,
Yeah, it's two separate. All I was
Yeah,
doing, I
definitely.
just wanted to answer the question about funding.
Mary,
Yes, thank you.
just a question, is the water flow issue, is it just not a big enough main or a big enough pipe going to that trailer, or?
Yes, and that's the bigger investment.
Mhm.
And the fire department said, we just, we can't give you a pass on this.
Fire safety, life safety.
Right. But with this sort of workaround, it was going to be doable. So we're just looking for that extra money to get us over the hump at this point.
Okay. All right, well then that's a really good reason to keep it up at the very top, I think.
If we turn this into a COG and everything, I'm fine with the way
Mhm.
everything's written down.
Yeah, the sequential order.
Yes.
Okay, thank you.
All right, no, thank you.
Now we can drop back to number 4, Casey.
Wait.
but-
Now we can go back to number
That's
4, which
right.
is number 3 on the list.
It's perfect. All right, so the current ask, and you saw the request is in the packet. And Carrie is, I think, standing by. She'd be happy to describe to you in more detail. So what I can do is do the sketch of it. Is that before the CCO or any other organizations spend money in trying to improve childcare access, Carrie felt like, as the person who's a very much a strategic thinker, was we need to know where the gaps are, where the needs are, and what it's going to cost for that need and that need and that need. And the hope is that it'll be a very quick turnaround time for a feasibility study so through the end of September. There are some projects that are in the works right now that will be, the need will still be asked of those projects to find out, is this something that the county, so the county writ large needs? Those are projects like childcare, licensed childcare provider at the community center, for example. Bayou, the Bayou Golf Course has the church, the Bayou Christian Church building is empty and is now available. So the feasibility study would look at, are there children, students, and parents who want to fill, these seats here? Where are the gaps? Is it better to do scholarships for students of particular families? The CCO is willing to and prepared to chip in money as well as part of a feasibility study. And so the ask from Carrie, with Carrie's support here is, and she's been working with Jenna Saunders and Jen Richter at the CCO, is to get a feasibility study together with funding from the county and from the CCO, and then have that all ready to go so we know where the gaps really are. And then at that point, whether it's funding from the CCO or it's funding from our CRF dollars, or if it's funding from a child care bill at Congress, we'll know where the needs are. And that'll be very helpful to people like the city of McMinnville when they're looking at where to set up childcare spaces. And part of it is that it was very challenging in the spring. There was emergency childcare spaces that were made available for the children of essential workers, and they never filled up. So I think folks really want to make sure that they go where the need is.
I don't have any problem with doing analysis to figure that out. My only concern is does Carrie have the time to finish that
Right.
by the end of September and the resources to finish that. But one thing I will tell you, Casey, is being the ex-mayor, we looked at using the old church out at Bayou, community church for other things, other type of gathering. And the fire department, again, like rural minor, they have a limited water flow. They just want to have a lot of water flow out there, because that's why that was originally supposed to be like 140 homes around the north side of the golf course. And they built what they built, and they found out they just didn't have because they're not running water from McMinnville down there. They're on their own water system. There just isn't enough fire for support.
So apparently with that one, the sticking point, they have a child care provider who is licensed and who has 2 sites in Salem who would like to set up there. And I think the city and the city of McMinnville and this provider have been talking, but apparently it's the septic system there that's the current challenge for that particular spot. But Commissioner, you were
all of those issues. A couple of things. So do we have a dollar amount?
No, we don't yet, because there's not a contract. The one company that does things like they do the surveys of parents and child care providers and businesses. They provided an estimate of $15,000 to get this done by the end of September and have the results. And that would be with Carrie doing, I forget what they call it. I think she's just support project coordination. Yeah. So 15,000. The CCO is proposing to put in, I think, up to 5,000, and that's to set up a database, like an online database, so that child care providers can easily connect with families. I think that's their component of it. I was going to say that if we grant approval to move forward with it, they're going to inquire, the CCO's Early Learning Hub is also going to inquire with Polk County about how much they would like to contribute. Ken.
Carrie just texted me, and I also just wanted to put, if you'd like Carrie to join, we can call her really quick and have her join the discussion. But in her text, she said that the request is 10,000 now and 5,000 from the CCO.
Okay, thank you. That's helpful.
So
we should keep talking so it goes down even more.
So a total of 15 or a total of 10 is the ask?
Total of 10 from us. From our-
10 from us.
from our CRF
And then
dollars.
5.
Or that we would be reimbursed through the CRF dollars.
Okay.
Yeah.
So we know for sure that we would be able to use this for reimbursement because I know that
Right.
a lot of counties are using it for childcare support. And we also have a lot of local nonprofits like WISE, the YMCAs and different things like that in different
Right.
communities are Boys and Girls Clubs are being utilized. And so we know for sure that this would be a reimbursable expense.
I think that what we know is that nothing is for sure.
That's true.
That was the theme from the chair's call.
Treasury guidelines and talk to Dennis.
I will say that, I mean, depending on what the actual, I can't, because you never know once you actually have, you submit reimbursement on the actual expense, if whether or not, but, the child care, there are specific categories under CRF funding
Right.
for this specific topic.
Yeah.
Now, the work that's being done, that's where sometimes you get into that interpretation or that discussion.
Right.
And I think once I have a clear idea of reviewing this, I feel pretty comfortable that I think it would be a reimbursable expense, but at the same time, I'm looking at county council as well. But if we need to make calls or get clarification from DAS or even from the Treasury on that, we can explore that and look at that to confirm it.
Well, I think if our share is $10,000, and for some reason, I believe it'll be fair under CRF also, but if it isn't, to get this kind of study done, which will serve us way after COVID. Gaps isn't bad. My only thing is I'm concerned with the September 30th date, because, if we would go with this, there's got to be a contract approved by legal counsel, and we have to approve the contract, and we're almost into September right now. So to go through those steps and get it all signed by the Board of Commissioners, to where we can actually get the contractor started, I don't see any way we can finish it by the 30th of September.
That might be a good reason to pull in Carrie on the call if you're willing. I know that she has a much better sense of the timeline
Well,
involved.
it's not.
She's been working really closely.
I know
with
that
Early Learning Hub.
Carrie's watched and she has been working real close, but the fact is outside Carrie's control. We do have to have a contract. We do have to have.
What's the total price?
It's 10,000.
That's the amount they'd like from
Us.
County.
us. What's the total price of the contract?
50.
That wouldn't have to come back to the board. It's below
25.
25,000.
But you still have to review it.
We
And
would.
Carrie clarified CCO would be the one holding the contract. We'd be
Okay.
basically making a contribution, and it's a CCO contract.
So then,
Okay.
yeah,
So then they
No.
would apply for reimbursement. Could we also be eligible for that reimbursement if they were in fact, the contract was under them?
I think it would be a similar setup as the YCAP housing, where we essentially provided funding to provide this need that falls under one of the COVID response categories.
And to clarify, the money that the CCO is putting in, it's actually the early learning. This about this a lot more. It's the Early Learning Hub has applied to the CCO for the $5,000 from the COVID relief fund. You probably know there's a pot of money that the CCO has for COVID stuff, and so Early Learning Hub is replying to them for it. And Seamus, granted his blessing for the Early Learning Hub to apply for that.
Okay.
And that happened last night.
And that would have to go before the board, but I don't see
That's
any for
I don't
the
either.
CCO board. I don't think there's going to be a problem.
Yes, you're right.
Knowing the great job and how much work Carrie's already put into this, I certainly wouldn't want to turn it down and not consider doing it. Because I think it would give us information way after COVID, over to continue to identify those needs for childcare, early learning hub, where we have gaps in the county. And I'll tell you, that amount, the county's amount, $10,000 to get that kind of study done is really pretty cheap.
Yeah.
Especially since it will be reimbursable, just going to bank on
Yes.
that. so to
Yeah,
speak.
exactly.
The other thing I'd want to make sure is that we all have some input into suggestions. So for instance, I look at youth outreach, the drop-in center is
Yep.
sitting there dark.
Right.
There's staff
Okay.
that they're doing outreach to the best of their ability, but there's an opportunity, and Newburgh really
Mhm.
does need that. And we can also look at other partners like Lutheran, and I don't know what Head Start is going to have its own set of
Yeah.
restrictions, but you've got a facility there.
Mhm.
And I know they're at capacity, but so we
Yeah.
need to look at all of these, leave no rock.
The entire range of them, from commercial providers to nonprofits to existing that can expand. Yeah.
Right, to churches,
Yes.
to preschools.
Another one that I believe that Jen Richter is the one who's kind of focused on doing that, is outreach to large employers in the county
Yes.
about hosting on-site childcare for their employees and what that would look like. So make sure that they get a survey as well.
And, that's happening quite a bit in Marion County right now, where a lot of the private, like the Wilco, the hazelnut producer in
Yeah.
Donald, they're building a separate building on site just for their employees for childcare. So.
Yeah.
I think
Yeah.
the private sector does, I think the private sector wants to take part
Yes.
in it. But I think this is a good idea, and since Carrie's almost, and she's done a great job, and since she's been working on it, I would like it to die. So I don't know if we have to give you further permission to.
What I'm thinking, because
Mhm.
although it wasn't on the agenda or it wasn't in the packet, and kind of fleshing it out, there's a $10,000 ask
Mhm.
for this program. And it seems like the board should probably take action and with a motion to
Yeah.
approve towards that project.
That amount.
I'm hearing consensus about the staff time and the green light for Carrie to continue working on this. But I think the board would probably need to take action.
Mhm.
That way we're not necessarily coming back on that, but if you're gonna approve $10,000 and,
Yeah.
and I'll figure out where that fund's gonna come out of.
Well, I guess then I would make a motion then, if there's no more discussion, you have any more comments? Mary?
Just that I want to make sure that we have in there a sort of a proviso that this money is reimbursable through CRF, and that we're making that clear at the beginning. I don't think there's going to be a problem, but just so that that's how we're viewing it.
Right.
Okay,
Yeah,
I make
and before, no, I guess I can add further discussion after you make a motion. Sorry.
I guess my motion would be that we approve item number 4, and that would be $10,000 for the Child Care Access and Education Support Project, with the addition that it needs to be reimbursable through CRF.
Okay, thank you, Commissioner. Any further discussion? All right, my point of further discussion is I forgot to mention that Jenna Saunders and Susan Muir, who works, she's the Parks and Recreation, and Jen Richter and Carrie Martin, they agreed on having 3 focus areas for the next month and a half to make sure that these things, when they're moving forward, that they look for sources of funding, is subsidies or scholarships for the children of essential workers. So we make sure that grocery store employees keep working. We make sure that firefighters' children can be somewhere. And then the other thing is to find new spaces to make sure that if there's a space that is going to work similar to what's the barrier, like the water supply issue. I'm trying to remember there's a third one that they asked about that I wrote down as a note here. But they really want to make sure that while a study is happening, that they keep moving forward with increasing childcare access with the different streams of funding that might be out there. And then the other one is the workplaces, is identifying workplaces and getting them going right away, since each company knows their employees. So just wanted to make sure that you knew that they were working on the short term as well as the long-term study.
And they will be addressing, collaborating with, or at least inquiring with our local nonprofits,
Yes.
like even if they bring in Catholic or Lutheran or, and even if you look at, for instance, our TTRS homes have a model where our kids are being covered in
Yeah.
that capacity. But
Yeah.
even just checking in with Provoking Hope to see that what's the need there for childcare.
Yes, absolutely. And what I'll do is I'll make some notes and send them to the group right, immediately after we're done to make sure that I remember that. Because I know they talked about that, about the nonprofits and religious institutions as well.
And I would also suggest checking in with the court. We do have, when things open up again, we have a lot of people who are needing to make court appearances and don't have childcare.
Yeah.
I looked into
Really good
working
point.
with Polk County's HHS director, it's something called Court Cares Project, and they got
Yeah.
funding for that.
Yeah.
And that is basically a babysitter. When you come to court, you've got somebody there to watch your kid. They got the funding for that and were able to go forward with a grant, but that'd be something else for us to look at.
Yeah, absolutely. Thank you for bringing that up because it's one that I keep trying to remember. I was on a call with Commissioner Pope and he described it in detail, but
Yeah.
Yeah, because I think.
Disappeared from my head.
Especially like with our identifying and working with our nonprofits and our partners, should be a big part of that.
Yeah.
So I think we all realize that.
yeah, I will be sure to send them a note after the meeting about that.
And also folks like Oregon Family Support Network and, just systems of care, the SIT teams, they all really have their ear to the ground on this issue.
Yeah.
Well,
Yeah.
If,
Oh, yes.
just want to remind you, do you have a motion?
We do have a motion.
Take
We're in
action
further
on yet?
discussion right now.
Sorry.
Yeah.
And, but the other part is, as part of that, and Carrie can come back and report at regular intervals and can share more information about the lists of partners and projects. And, because another important partner that she wanted to make sure that we called out is also the tribes.
Yes.
So
Yeah, and
that's
I
number
checked
one.
in. Thank you. Actually, I was meant to mention I checked in with the tribal council and their facilities team about whether they had space out there. That if we had a child care provider, a licensed who was ready to go, whether we could, connect them. And they said space is really tight, but they're definitely open to it.
Great.
Yeah, because especially for tribal members or employees, that's a big draw. And it's a long ways to go for
We can have
childcare.
more discussion. Why don't we vote on?
Yes, that sounds good. Yes, all right, thank you. All in favor signify by saying aye.
Aye.
Any opposed, same sign. Records show unanimous approval of the motion that Commissioner Olson made.
Okay, and I have just a few.
Yes,
comments based on what Mary said. I think us as commissioners, Carrie is going to check in, Mary, you said of all the partners. I think as commissioners, if we know groups, certain groups like Youth and Family Services, that each one of us can compile a list of groups we think may be involved and send those to Carrie to make sure they don't get dropped off.
Mhm.
Good idea. Yes.
All right, thank you, Commissioners.
And the
Yes.
one thing I was gonna suggest, because we went through the exercise under number 5 and had that discussion.
Yeah.
And I know we were prioritizing that list of projects. I don't, it's up to you, but it probably wouldn't hurt to do some type of formal action on the list, the prioritization, as provided and discussed.
Yeah.
You may want to have a motion and take action on
That's a
it.
really good point. Well, I'd be happy to my draft motion is that I move that we approve the priority list for the projects that we've submitted to the Economic Development Administration for grant funding, as shown sequentially on the document that we have of the projects. Okay.
That worked.
All right.
Nice job.
All in favor signify by saying aye.
Aye.
Any opposed, same sign. Record show unanimous approval of that motion related to item 5.
And I'd just like to take a minute and really thank, not just Kim, but thank Carrie, because she's been working so hard on so many different projects that, it surprised me she's working this hard on this project, because that's the way she works hard on every project, and I think she should have just a little for the good job she does.
Yes. Thank you, Carrie
Yeah,
Ann.
thanks, Carrie. Oh, yeah, Carrie Ann, that's right. I'm not going to say it, but you said it.
Carrie Ann.
Yes, and thanks to Abhishek, because again, she also worked, the two of them with Ken worked so quickly on these projects.
Thank you, Apisha.
All the credit goes to those two.
Oh, wait, that sounds
Yeah,
good. I'm
Abhishek.
happy to pass it on to them. All right, Commissioners, thank you. We will move on to public hearings, which is letter G, and we have none today. Move on to item H, which is announcements. and we have time for announcements.
Yeah, isn't that amazing? I just have a
Yeah.
couple, but the first one is, and I'm discussing under announcements because I forgot to have it put on the agenda, that Polk County, as you know, on the intersection of 99 or Highway 22 and Perrydale Road, we've had some Yamhill County residents killed or seriously injured because of that, and Polk County would like us as a commission to do a letter supporting their effort, no financial commitment, but just a letter like they did for our bypass, of encouraging ODOT and the state to work closely with Polk County to actually redo the intersection of Perrydale Road and Highway 22, because the way it comes in an angle, it's very dangerous. That's why we have a lot of people killed.
Yeah, that is a road that our people use to, county residents.
I spoke to a commissioner out there about this, and he said, how come we don't have more of a collaboration, for instance, with your sheriff's office and with us out here, alerting us when there's been an incident.
Yeah. Well, that is something to you, Commissioner, do you want to,
I have
Draft
enough,
a-
I
just
have
a
enough, and I'll draft, what I'll
Yeah.
do is draft a letter and bring it back next week.
Oh, great.
Okay.
Thank you.
yeah,
Put
great,
that
thank
on
you
the
very
agenda
much.
for Next week. Karen.
Okay, we'll have that noted.
And then the other thing is I was on a Zoom call this morning with the National Association of Counties Healthy Committees Committee, Healthy Committee Subcommittee, Healthy County Subcommittee, and the experience we're seeing here in Yamhill County is the same experience counties all over the United States are experienced. The counties with COVID, partly open, not open at all, no plans on opening at all. And so I thought it was interesting that we think about Yamhill County, but this issue we're going through, almost every county in the United States is going through the same issue. And they're working on legislation to introduce to actually enhance how counties are approached regarding CRF funding and what CRF funding is really needed and what a lot of the counties think the guidelines really should be, based on one size doesn't fit all, because every county is different. And that was a very good conversation, so.
Thank you for getting up early to do that East
Yeah.
Coast
Yeah,
call.
just because I'm up by that time, but when you have to think about getting up at 5 to get on a 6 o'clock conference call, since it was in Washington, that was kind of tough.
Mhm.
And that's all the ones I have right now.
Well, thank you, Commissioner Stara. I was like, I got distracted by, I sent you guys something in the middle of the,
Go
while
ahead.
I was listening to him.
Do you want to
Okay.
go?
Yeah, so two things. We just got a letter an email from Bill Bartline, Commissioner in Tillamook County, as you guys know. And he was asking for support in declaring, it sounds like that public safety a tourism related expense. So it's something maybe we can talk about next week. I don't actually know the information about it, but I'm assuming it's related to the fact that they've been so challenged by so many people at the coast over the last few weeks.
Traffic.
Yeah, so I would say overwhelmed is an understatement
Yeah,
for
that's an
their
understatement.
experience over at the coast. So I do want to make sure, I'm going to read it more closely, but maybe it's something we can discuss next week about how we might provide some level of at least vocal support.
Yeah, I don't have any problem if you want to put that on the agenda and learn more about it.
I just want to make sure that we recognize that we really, as counties, really are all in this together, and their challenges end up being our challenges. But the other thing that I sent to you just now was the notice of funding opportunities for Title II funds from as part of the Secure and Rural Schools Act, I guess it would be. There's an opportunity to submit project requests, and the deadline for submittal is, I think, September 30th. So another wonderfully short window. But I have some ideas that I've been checking with some of our partners about. So I wanted to bring this up as something that maybe we could discuss either next week or the week after. to see if there's any interest. And this is, again, money that's dedicated to forest and lowlands infrastructure that either promotes alternative revenue sources to the county, that it promotes recreation, that promotes ecological restoration. It's kind of a big window of stuff. So one of the things that I checked in with is whether Weyerhaeuser would be interested in partnering. They've expressed interest in working with ODF&W and the county to improve access to their public or to their lands and then public lands past them. So that was my first kind of idea about it, and we'll see whether they do still have that interest. The last time we talked, they had interest. So,
Well, it also says that it also, these funds could be used to protect tourist visitor health and safety. So there's that broad reach as to whether or not,
interesting.
and in what capacity law enforcement and what law enforcement
Yeah.
would be.
Okay, great. Yeah, thank you. So we'll talk about it some more. But Ken, sorry.
Well, just a reminder on the secure rural schools and the act.
Yeah.
You know, we do have funds in our budget that are identified each year that we received under the Title III funds. You know, you have the various titles that fall under this program. So we have Title III funds, and then they have restrictions on what we can actually use those Title III funds. And I know this one is about the Title II funds, which is special projects on federal lands or has a direct benefit or access, you know, for federal lands. I have limited experience with this. I many years ago applied for Title II funding, submitted a grant application while I was the parks manager. So, you know, so I have a little bit of experience. We weren't successful in getting those funds, but you know, there are some strings attached on the eligibility and the types of projects that we can consider applying for this, and it goes through the Bureau of Land Management.
Right.
Okay, thank you for that.
And I'm excited about continuing to build up that connection between BLM and Weyerhaeuser and the county. And I think that the law enforcement or security component would be really good if we can make it match. So be thinking, I'll ask to put it on the agenda for next week to have further conversations.
Great.
Okay, thank you.
Thank you.
And that's all I have for now. It's my homework, but Commissioner Steer, what would you like?
Couple of things. Did receive a letter, you probably received it as well, commissioners, from a local restaurant owner. And this is one that I shared with the governor's spokesperson, Leah Horner, yesterday. This came from a local restaurant owner. I'm not going to use the name, but it's a large establishment here in McMinnville. And the letter was written to Representative Noble, shared with the commissioners. And it basically says that the recent press release from the governor's office has caused great concern in our local restaurant industry. This report shows no indications that restaurants are a driver in the spread of COVID. And yet we have local restaurants that have shut down, and this could be a substantial impact should there be another shutdown. So they're concerned about that. Recently, there was an OSHA complaint against this restaurant because they were not following social distancing. So basically what we see is now they're having to answer these complaints, heavy-handed, you know, enforcement types of responses when we see that the state is not really being consistent in how they address these types of issues. If you look at what's going on as our cities are burning, there doesn't seem to be a heavy-handed approach there, but let a business owner have too many people close together and they get a complaint. Now, as this restaurant owner points out, they're looking at 55% of normal sales levels because of how many people they're allowed to have, but they have 100% of the costs associated with it. So I do feel that it's contingent upon us or incumbent upon us to really be advocating for our businesses. We already lost Valley Commissary. How many more times does this have to happen?
Well, I don't know, Mayor, also I can tell you is I've been into that particular restaurant twice in the last like 3 weeks. And to say they're not social distancing is anything but the truth. As I said, 55% capacity. They're probably doing a good job of social distancing and the mask requirements of any other restaurant I've ever been into. So I don't understand that ownership.
Yeah, it's of concern. And also the OLCC is being sort of weaponized and used against local businesses. if you look at the fact that 99% of all the businesses, the 31 million businesses in this country are small businesses, this could destroy what's left of those who have managed to stay open. Again, I just think we can't lose sight of the fact that we're looking at a lot of people losing their jobs. Another issue which has come to my attention is that OSHA is now proposing sort of upping the ante on their temporary rules, which are not so temporary because they talk about instituting permanent rules. So these rules that we're seeing in place for businesses are not going anywhere. They're accepting public comment on that. I have to say I don't have a lot of confidence that those public comments will actually net any difference. But if you look at the OSHA framework, they're actually measuring, the feet distance between the mouths of affected people based on how tall you are. I don't know how any business can possibly sustain that. So a couple of things. The legislature decided not to address any of these concepts on increasing rules at OSHA. So the legislature didn't want to touch it, but OSHA says we've got the authority to do it. I think OSHA is now getting unchecked authority to mandate new and permanent workplace controls, and I think it needs to be stopped. If you read these, it's absolutely, it's almost like you're reading a skit from Saturday Night Live. If somebody is this tall and you measure from their mouth or from the top of their head or from the bottom of their nose, and it gets to the point where what business owner or what business could possibly sustain this? So I'm just going to encourage people to contact your legislators, your Oregon legislators, contact the governor's office, contact OSHA during this comment period and say, this is getting a little bit out of control.
Did we all get that email, or just to cut the?
I can send you the link to where it is on the OSHA website, so you
That'd be
can
great. Thank you.
read it for yourself.
Yes.
I would just add that I've also been, I've seen, and I can share it with the board because
That'd be
right
great.
now,
Thank you.
because I ended up getting it through one of the listservs that I happened to be signed up on
Sure.
for OSHA, and it caught my attention because some of that is also going to have implications on the county as an employer as
Yeah.
well. And I currently have the internal admin team, HR, and Justin, as well as facilities, also looking at the OSHA requirements, because if they do go into effect, it's going to require a lot of actions on our part as well as an employer.
Yeah.
To implement if these rules go into effect. So we're currently reviewing, and so I have the information and I can share it with the board.
Okay. That sounds great. Thank you.
Thank you.
Yeah. Thank you, Commissioner.
Just the call that we had.
I was just gonna ask you.
Spoke with, we were on the call with Jody Christensen and Leo Horn from the governor's office. And one of the questions came up is, what are our community-based organizations doing with the funding that they're getting? What is it being used for? Do we have any collaboration? Do we know what they're doing so we can collaborate? That seems to be money's being doled out like it's being printed, and yet nobody knows who's doing what, which would be important for us to know. The other thing is, as you know, that our clerk has brought to our attention that there's some funding available, but there would be a required match, and that would actually help us with some equipment at the clerk's office. But I think what we're seeing is that the state doesn't want to kick down with the match, so that we are in essence going to lose that. And also our unemployment situation is not getting better. We still have people who are waiting for checks. It's going to the wrong addresses. And again, we've got money that was spent, that was earmarked for fixing this software. It never happened. And when asked about it, our legislators said, well, we want to do it right. And it wasn't happening with the company we're working with. I believe Senator Roblin said that they tried to get a fix. It never really went anywhere, and they want to do it right. I'm wondering how many years it's going to take for us to get this, to get this project going. So I am concerned about
It's really
that.
interesting, because being a certified project management specialist and working in IT and everything, I'll tell you what happens in these kind of projects. In every project, everybody, private companies, public, do the same thing. There's certain modifications that you have to make to support the way you want to do business. But companies like this last one the state failed in, they took the base package that was being proposed to them.
Mhm.
And by the time they were done, it was a whole different custom package. So instead of taking something that does 90% of what you want to do and modifying 10%, they tried to write a whole new system. And I know I witnessed it at Oregon Mutual. I met witnessed at the city. So it's like, hey, I think the city could actually get 90% of what they want in a new system if they would cannibalize or customize it only where needed. But companies have the culture of, yeah, it's a great product, we love it, but now you have to change this, and you have to change this, and you have to change this, to the point where it's a never-ending thing. And I think that's what happened with the state.
Good to know. Thank
Yeah.
you for that.
Yeah, definitely. And I have a question that's still pending, and they know that it's still pending with me about the elections, the funding for improving election security and COVID-related expenses. Specifically, the questions were, is the state going to match? If the state isn't going to match, will we still be allowed to use it if the county puts in a match? And then will our county match be covered as a reimbursable CRF expense? Because I was like, let's go down the line of them. So that's a pending an answer, and I'm supposed to have one by the end of the week.
The other concern is, though, Mr. Chair, is that the e-board did not address this. They had the opportunity to address it. So in other words, are we allowed to, as a county, access a program that the state has paid no attention to?
Right, that is the pending question, basically. Yeah.
Okay,
So
but
I've got
thank you.
two people who say it's pending still.
But we're running out of daylight.
Yeah, exactly.
It's got to be expended by December 31st.
Yeah, and ideally it will be to improve the process at election
For
time.
elections, so there
Yeah.
goes that.
But it's been really wonderful hearing from the clerk on those calls so that he can make the pitch to everybody there.
Yes.
Yeah, Brian's been, on the calls he's been on, and the way he's explained things to citizens, what he's put out, he's just done a wonderful job.
Yeah, he has.
Yeah. Okay, anything else?
That's it. Thank you.
That's great, thank you, I really appreciate it. Ken, do you have anything?
I don't, just a reminder that we have an executive session scheduled immediately after this session.
Okay, thank you. Christian,
I'm
do
gonna
you?
take a little break.
Just a reminder, we were scheduled to have the TEFRA hearing today. That's been put over to next week. So we will have the TEFRA hearing for the Linfield bonds and the public hearing that goes along with that on the agenda for next week.
Okay, great, thank you very much.
Happy birthday, Christian.
Thank you.
Thank you, Commissioner.
Happy birthday.
Thank you to the elves that decorated my office. I can't seem
We
to
don't know what you're talking
pin
about.
that
Nobody
down
knows
on
what you're talking
Oh,
about.
anyone in
gosh.
particular.
And they
Carolina, do you have anything?
you never will.
That's
Okay,
right.
well, with that, thank you. I will close this meeting at the Antrim County Board of Commissioners. And we'll do a 3-minute break.
Thank you.
Yeah. Commissioner Sarah always asks for a 2-minute break, so I thought we'd bump
Yeah.
it up a little bit.
And you're like,
I thought
who are you
if I'd
kidding?
asked for a 3
2
minute,
minutes
she'd
is not
ask
gonna
for just 5.
Oh,